So it's important to have some tests done, first of all, to find out what the reason is for the fertility problem, because there are some fertility treatments that are not IVF that can be used for some conditions. So, for example, women who aren't ovulating might just take tablets to be able to try and ovulate. But once the decision's been made to go with IVF, there's really sort of three important tests that are done. Um, the first is a test for the woman, which would involve an ultrasound scan, and that's really just to check that the womb is all okay and that the ovaries look fine and there's not any funny cysts or anything going on. It can also involve counting the number of little follicles on the ovary, and that gives us an idea of how well the ovary is likely to respond to the stimulation medication. That's something called an antral follicle count. Alongside that, the woman will have some blood tests done to check a marker called AMH, which stands for anti-Müllerian hormone, which basically tells you the same as how many follicles there are, what the egg reserve is, and helps plan what type of it's called protocol or recipe is used for the IVF stimulation medications. The man would also do a sperm test, and that's really important to check that that's if there's any issues with that, because the last thing you want to happen is to go through all this process of IVF, collect eggs, and then suddenly on the day of treatment find out that there's a problem with the sperm test and not able to do treatment at all. So to help with planning, a man would normally do a sperm test. Also, some clinics would do some other blood tests to check that you're not anemic or that your thyroid function is okay. And then finally, both partners would be advised to have some screening bloods done to check for hepatitis and HIV. And the reason why is that's a UK requirement, that if you're going to work with eggs and sperm in the lab and potentially freeze egg, sperm or embryos, you need to have had screening done to make sure you don't have those conditions, or if you do, that can be discussed with your particular clinic about how that would affect your treatment.